Welcome back to the Manifesting Health series. I'm Curry Bordelon, your host for this discussion. Today we have Dr. Deborah Stamps and Riley Walters for this episode of The Power of Partnerships. We'll have a really interesting conversation about partnerships and how partnerships develop, along with some of the other benefits to partnerships. Dr. Stamps is the National First Vice President of Chi Eta Phi Sorority Incorporated. Riley is a veteran nurse of the U.S. Army and is the president for the Pi chapter in Durham, North Carolina, and the chair for Men's Health Committee for Chi Eta Phi Sorority Incorporated. Thank you both for joining us today, Deborah and Riley.
Thank you for having us.
Thank you.
Excellent. Thank you so much. So, as you know, we're going to spend some time talking about partnerships and some of the things, Deborah and you and I have talked about in the past. But before we do that, let's have our listeners get to know you a little bit more. So, Deborah, can you start off by telling us a little bit about yourself?
Wonderful. Thank you again so much for this opportunity to not only be a partner, but to also be able to talk about our story and our journey. In Chi Eta Phi Sorority Incorporated as the National First Vice President, I'm responsible for partnerships, for programs and projects, and under that umbrella comes a lot. So our motto is Service for Humanity. We do a lot of service. We partner with organizations locally, regionally, and at the national level to ensure that we are educating our communities on topics for disease prevention and health promotion. That's really what we do. Whether it's blood pressure screenings, kidney health screenings, men's health topics, this is really what we're about. We want to make sure that the communities in which we serve and where we're located are able to make, those members of the community are able to make informed decisions about their health and that they're knowledgeable. They know what questions to ask. And I'm a little biased, I will say that the profession of nursing is where I always try to guide young people to, whether male or female. And men's health is a specialty. We have men in our lives that, whether they're our parents, our husbands, our brothers, ourselves, and we don't really talk always about the journey of the profession of nursing for men. And we know that nationally, men in nursing has not really moved much. It's moved a little bit, but not as much as we would like to see it. We're still less than 20% of the nursing population, and we need to move to be greater than that. And so increasing that awareness that nursing is a wonderful career, but even more importantly, that it's open to men. And when we are bringing men in and diversifying our organizations and our profession, it really gives us more rich knowledge and understanding, both of the issues, the health issues, the workplace issues. So I can go on and on and on, so I won't, but
We're going to have plenty of time. This is going to be good. Yeah.
I'll let Riley jump in. But the partnerships are really important. And in the environment today, the way it sits, we all can't be rowing separately. We have to really row together. We have to stack hands, and we have to collaborate. And the way that we do that is through partnerships. And what I love about our partnership is the fact that we're able to provide education and awareness, but we're also able to be present in each other's organization. So whether it's through a podcast or through an education session or attending the conferences that both of us have, we're able to truly come together. And we're just stronger together. We really are. And this topic is just really near and dear to my heart, men's health.
Well, thank you so much for sharing this. And it's so true. And you've touched on some really great topics that have really evolved over the last couple of years between our relationship, Deborah, and some of the things that we worked on at the national and local levels. So I really appreciate that. And we're going to talk a lot more about that. Riley, tell us a little bit about yourself. And as we do that, thank you again for your service and happy early birthday for the U.S. Army, which will be next month. So we're really quite excited about that. So tell us a little bit about yourself.
Riley Walters. I am the president of Pi chapter in Durham, North Carolina. I joined Chi Eta Phi in March of 2003. Since being in Chi Eta Phi, I have been active in the region, which is my Southeast region, and nationally. Since meeting Dr. Stamps, he keeps me involved in everything. Men's health is important to me, and I'm also the chair of the health committee for the NAACP in my local area. So I am involved with health promotions there as well. I'm really concerned about the way things are happening, not just for men's health, but nationally when it comes to Medicare, not Medicare, Medicaid, with it being cut, so many people affected. I'm really concerned about where we are headed with diseases. So we do need uh, organizations like Men in Nursing and Chi Eta Phi to educate people to keep them from getting diseases or preventing or making them less dangerous to them.
Excellent, Riley. And you bring up a really good point, and I'm so glad you did that because that's a perfect segue as we move a little bit further into our conversation. Is there is a lot of change happening at such a rapid pace that there's so much difficulty in processing. And like Deborah and yourself both have said, of the concern about health issues and how we are disparate, men in general are disparate when it comes to life expectancy already before the current challenges, life expectancy, health outcomes, disease processes, preventative care, supportive care from network and state and local governments and so forth. But also the same, the disparities are even more profound in certain ethnic groups and background and racial groups and so forth. So there's so many different challenges. One of the things that we try to do within our organization, and I know you all within your organization, is show that unified message and really try to bring that message forward. Because I was I was listening to a podcast not long ago, and the specific message that really resonated with me, and this is true from time, is a single voice has less impact than a collective voice. And so that collective voice, through a partnership such as this and through certain activities and educational offerings, provides a bigger, booming wake up in many ways. Riley, can you talk a little bit about what you're doing in the the Durham area? What are you doing? And in collaboration with your men's health work on the national level, how are you getting that message across, not only of the disparities, because the data is the data, and we can't refute that, it is what it is, but how can we do that in this very fragile and ever-changing climate? What can we do right now, Riley?
We can partner, as you and Dr. Stamps have said, because when we partner with people, we touch a broader community. We have health fairs. We educate them on diabetes, on prostate cancer, lung cancer, heart, especially women with heart health. So that's how we do it. We do it through education and collaboration.
And don't stop doing it. We can't stop. We can't let up because we could be crippled by the constant noise and barriers that we're seeing right now. We could be crippled by that. We just can't stop. We cannot stop what we're doing. Deborah, do you have something to add to this?
In addition to what we do at the local level, such as the health fairs and men's health conferences, we partner with organizations like churches. So we have the opportunity to be in churches. And, one of the things that happens is that members of Chi Eta Phi will bring a health moment per se, or something, a topic like that, to the church where they can actually talk about the importance of PSA testing and, get your results, know your numbers. We partner with, we have actually on the national level, we have a resolution that's going to be presented at our biannual meeting that talks about our commitment to men's health and men's health, both from an awareness and disease prevention, health promotion perspective, but also men in nursing, why it's important that we increase the diversity of the profession. We know that mentorship is important. Having men that can mentor, coach, and guide those that are entering the profession or changing their role within the profession.
Such
Many
a
times
powerful
we have,
tool. Yeah, such a powerful
yes,
tool. Yeah, exactly.
so many times we have members that are in practice or academia and they're going across that specialty or even within the specialties, going into a leadership role and so forth. So being able to not just guide new nurses, but being able to open the doors and have leadership and scholarship together,
Right.
it increases the visibility. There's so much power in what we can do collaboratively than alone. One of the things, and Riley is very modest. We brought together a group, this committee that he leads on a national level, and it's not all men, it's men, women, but everyone is focused on how important men's health is. How do we get our arms around building the trust and the relationships? Because a lot of it is
Right.
um, that or people don't trust, and the partnership piece is not performative, it's purpose driven.
Mhm.
So we're partnering and building bridges not only within our organization, across our organization, but now with your organization. So we're coming together and again building that tapestry.
Right.
It
I'm so
work.
glad you mentioned that. And Riley, I want to hear from you on this is talking about it's not just men that are engaged in these activities or men that are engaged in these community events or reaching out to the community or churches or what it really is a collaborative effort and not just nurses. It's nurses along with, whether it be male, female, it's an understanding that it's about supporting health disparities across the board. And we as nurses, this is what we do. We as a partner, this is what we do. And it's important that we want to improve our health and our outcomes within our communities. Truckloads of evidence talks about you improve the outcomes, you improve the community. You improve the access, you improve the community. There's so many positive benefits. Riley, do you have some examples of some of the things you've done in the Durham area that specifically have really helped not only healthcare initiatives, but specifically men's health initiatives in that area?
We have worked at making men more aware of their health because men have a tendency to ignore their health.
Yes, we do.
And they only think about their health when their wives or the women in their lives tell them, you need to go to the doctor. You need to have that checked out. And that's when we respond. Uh, so we are trying to educate them to be more proactive about their care, about their health, and about their health care. When they do go to the doctor, they know the right questions to ask and they know about their bodies.
That's incredible. That's so important because, like you say, sometimes we don't, that's not the first thing on our list, or that's not part of what is important on that importance list. And it's either someone pushing us in that direction, or whether it be any of the type of clinics that are out there, mobile clinics, barbershop clinics, whatever it might be, to help bring that awareness. But it might be that catastrophic event. And now instead of getting in front of something, you're 8 months, a year, 2 years behind on something, which drastically can change your outcomes. And so it really is important. And I applaud both of your activities and what you're doing. And I am thrilled about our partnership and see where our continued efforts can come together with activities such as this, but looking at more structured educational opportunities and webinars. So we're really excited. Not to mention next month is Men's Health Month, so it's going to help bring even more awareness. So We have a couple of minutes left together, so I want to get some big takeaways before we close out today. Riley, I'd like to start with you. What are some big takeaways? If you had somebody listening to this and has really been out of the loop of their own care, out of the loop of their own importance of care, what would you tell them right now if you saw them in a space to say, this is important? What would you tell them?
Be aware of your physical health and your mental health. Do not be ashamed, especially if you have a problem with mental health. Be upfront and take care of it. Also, always help somebody else.
Mm.
Once you find out about your numbers, then tell someone else they should have their numbers checked as well when it comes to prostate cancer or PSA.
Right.
When it comes to heart, once you go and have yours checked out, tell your friend that he or she should do the same. Because when you bring one, that's helping one, and you will continue the trend to help somebody else.
Thank you so much. I love those takeaways. Don't be afraid and paying it forward. You need to move that next other person, your closest friend, even. And I would love to see more health systems innovate more, the two for ones, if you will, type thing where you bring a partner in, bring someone in into that space. So I really appreciate it. Deborah, what takeaway would you have for any of our listeners today?
I don't know if I can follow up on
It's
that.
hard to do. That was
Yeah,
pretty good.
thank you so much, Riley, for leading that. You know, I think first and foremost, partnerships opens doors.
Right.
And those doors that get opened are mentorships, career pathways, leadership roles, and we help to lift each other as we climb, right? That's how we change the profession from the inside out. It's not this external factor that's going to come and make everything wave a wand and it's going to be better. I am proud of Chi Eta Phi partnering with Men in Nursing. We're sending a clear message that everyone belongs.
Yeah.
We're modeling that diversity, the diversity that we want to see in every clinic, classroom, organization, care team. That's what we're doing. And just to sum it up for me, when we talk about advancing health, we have to talk about advancing who's at the table. And
Right.
supporting men's health and uplifting men in nursing isn't just about fixing stats. It's about building a more inclusive, more effective healthcare system for everyone. And again, tying in the partnerships like this one really proves that when we come together, we don't just influence change, we become the change.
Thank you both for those messages. I really know it'll certainly resonate with our listeners, and we're really excited about that. And thank you both for joining us today. Thank you, Deborah, and thank you, Riley, for joining us and sharing your stories and talking about how powerful partnerships can be to improving outcomes. And thank you all for listening today. We really appreciate it. Looking forward to seeing you next time on Manifesting Health. Thank you.